Health crisis like no other. The spike in overdoses due to heroin and opioids. We've reported on it here at WHAS 11. Nearly 700 overdoses in January alone of this year. In one 32-hour time frame, 52 calls for overdoses in Louisville for first responders. For those working the front lines in EMS and at local emergency rooms, it really can be overwhelming. But there is something to be learned from all of our first responders and physicians. And joining me to talk about it, Dr. Robert Couch. He's a medical director of the emergency department at Norton Audubon. Thank you so much for coming. Because I said, on your worst night, and you said, I remember it. What was it that you saw? We just saw case after case after case of heroin overdoses. My first patient, my second patient, my third patient, and it just kept cascading after that. So what is it? What touched all of this off? Some of it was because the cost of heroin became so cheap. Is that part of it? But then what made it get to this crazy crisis? We understand now better than we did at the time. The thing that's driving a lot of the overdose deaths now is the addition of fentanyl and fentanyl derivatives into the heroin supply so that people really don't know what they're injecting. Some of these more toxic drugs can be lethal with just one dose. So you see it and you treat it, but I don't know what you do when you want to prevent it and stop it. And so what do you do? How do you tackle this? Because it's so massive. It is. The emergency treatment is very straightforward. We administer naloxone, which is an antagonist that completely reverses the effect of the opioid, be it heroin, fentanyl, or another derivative. It works almost immediately. What we're seeing is we're having to use bigger and bigger doses and repeat it over and over again more often with some of these newer drugs that are on the street. And we're going to talk a little bit more about ways that we hope we can cut back on addiction. But it's not just the overdoses, and obviously death would be the ultimate, but there are just a litany of problems now coming from this. What else are we seeing? Sure. When people with substance use disorder are injecting drugs, they're injecting bacteria and who knows what else with it. So we see problems like drug-resistant abscesses in the skin, drug-resistant pneumonia, heart valve infection, spinal cord infections, things that really were relatively rare just a few years ago, but now they're becoming much more commonplace. Two things that we can do to cut this down. One thing I thought was interesting, non-opioid medications to treat pain. That's one place we can start, correct? Exactly. We need to understand as physicians better the differences between acute pain and chronic pain and understand how to treat those. So for chronic pain management, we're looking more towards non-narcotic, non-opioid medications to treat chronic pain. And is there something you could tell a family, because we've seen so many times how many times it might take before somebody with treatment for it to work? Any words of hope you could give anybody out there? It's hard for people to go into treatment on the very first visit, but stick with it time and time again. Treatment can be effective, and people are in recovery who have been in the worst throes of this epidemic. So recovery can be possible for anyone. Just a few seconds left. In your work as a physician, I don't know how many years your career spans, have you ever seen anything quite like this? I've been a physician for 30 years and I've never seen anything of this magnitude. It really is frightening. It is. Thank you so much for all the work you do. And we want to let you know, if you are looking for help, a place to turn, we want to give you a couple of suggestions. You can see those on the screen right there. We are looking at the New Vision program at Norton Audubon Hospital. The phone number there is 636-4967. Another number, Substance Abuse and Mental Health Services. That phone number, 1-800-662-HELP. And want to let you know, next Wednesday,